Dear colleagues, I think this is the first time I don't have to participate in a Zoom conference and say, can you hear me? The gentleman up there went through the lack of a post-pandemic international system actually stems from the problem of a lack of a pre-pandemic international system. And as many colleagues mentioned, we have not learned much. And that's what I'd like to touch upon. We as people, as humans, have not learned enough over time, whether we look back at the plague or 100 years ago to the Spanish flu. We continue to make the same mistakes, and let me explain from an example. After the Spanish flu, the world diseases and illnesses would regularly meet and come together. During the meetings, they would bicker about who is the most deadly, who is the most infectious, and they couldn't decide on who could chair the meeting, but they always grew in membership. And each year, or every several years, more illnesses and diseases came to these meetings, whether it was the common flu, polio, smallpox, measles, cancer, heart disease, AIDS, Ebola, diabetes, the bird flu, or the swine flu, or the reemergence of the swine flu that we have heard today, or the COVID-19 virus that we are discussing today. Well, in the meetings of the diseases and illnesses, these meetings were always attended by other factors, strange, dark entities that were always there, ever present. The ones that knew them knew how to call them. Their apathy, complacency, denial, fatigue, indifference, ignorance, and others. This is the part of these diseases and illnesses that are always there, but we don't always address them specifically. And these dark entities would listen to the conference, smile, shrug their shoulders, shake their heads, and move on. And we continue to not recognize these actors, and we deal with them through optics and politics. And it has long been there that in governments and in decision makers, the least information that we have, it's the easiest to make a decision. So the less information, the easier decision. The more information, the better decisions that we can make. And if those decisions are based on fact, we can also make the best decisions. But this is not always the case in these particular situations. The WHO this week has been reminding us repeatedly and saying, don't let your guard down. It's quite clear that there is complacency, there's denial, and it is our duty to report to one another in the public accurately, truthfully, and with factual information based on science. And this is the challenge that we have from an individual perspective and a government perspective, that we have world actors that are in constant denial, and we have populations that are in fatigue. And it's something that we have to deal with, but we've dealt with it we haven't dealt with it before, and I think that's the problem. We saw it in the Spanish flu. It was mentioned by a Brazilian colleague saying that people were dealing with the Spanish flu, and then everyone celebrated the end of the Second World War, which in fact created a second wave, which killed more people than the First World War did in the first place. So what I'd like to say is that we have to deal with these side effects just as much as we have to deal with the illnesses and the diseases in the pandemic situation we have now, and also discuss it in a pre-pandemic system in the future. We have to change our habits, culture, and even traditions, whether it's freedom of assembly, whether it's handshaking, hugging, kissing, at least in the short term. But we are in a marathon. This is not a sprint, and some said that we don't know if there will be a second wave. Well, there will be, guaranteed. Whereas in some countries, it's already there. And looking at the experience from the Spanish flu, it will continue. And that we have to be, again, honest and factual, and base our arguments on these, and to educate and inform our citizens truthfully and accurately at the national level. And that is part of the problem. I think we can quite clearly see that some countries hid the data from their people, hid the data from the international organizations, from their neighbors, from the World Health Organization, and that becomes a problem for all of us. In Latvia, we have tried to base our decisions on facts and on the science. In a crisis, just our Israeli colleague mentioned, a crisis can lead to opportunity. A crisis can be a challenge and lead to innovation. In Latvia, we had a case of an MP being infected early in March. He was a member of the coalition. He had been in meetings with the government, with other MPs, and immediately there was a political crisis. The government, including the Prime Minister, went into self-isolation. That led to government meetings in a virtual form. But then also it became discussed, and immediately there was a tender out to actually look at how to create a virtual e-parliament, and it was done. And now for the last 2 months, or no, at least a month, our parliament is meeting in a constitutional manner, but not physically in the parliament altogether. This is something that for a average-sized country, this is something that we experienced, and we could share this experience with others. Another innovative solution that came, we had very good manual contact tracking. But since we have a large part of the population using smartphones, a good internet system, our IT specialists look at how we can do this through IT. And in cooperation with Google and Apple, Latvia created an application that we are using in a national way, and we can share this procedure with others. So this Stop COVID application is very effective. It honors privacy, data protection, and is effective in being a virtual, very well thought out application for the contact tracking. And as it was mentioned before by the speaker, this virus does not respect the Vienna Convention on Diplomatic Relations. It doesn't respect religion, race, social status, or incomes. And this is something that we have to deal with in the long term. As any illness or disease, the longer we are in a status of denial, the longer the treatment and the more difficult it is to cure this disease. Surges and second waves are here and still to come. We must live and adjust to this new norm. And find the challenge that we have is to live compared to our livelihood. In inclusion, I could say on a lighter note, Latvia is a country of many introverts. And when maybe that's part of the reason why we have so few cases and so few fatalities. Because when someone says, keep your distance 2 meters. A Latvian usually says, well, why so close? Thank you for your attention.